fired for refusing to take the experimental COVID shots. That's the topic of today's Bold and Blunt. And I'm your host, Cheryl Chumley, giving you a Christian conservative look at today's news, politics, culture, and events. Do a Google search on how many Americans fired for not taking COVID shot, and all kinds of headlines come up. Hundreds of hospital staffers fired or suspended for refusing the COVID-19 vaccines. That was from ABC, September 2021. Advocate Aurora Health has terminated 440 employees who were not vaccinated for COVID-19. That was Fierce Healthcare, February 2022. Thousands of workers were fired over vaccine mandates, their refusal to participate in the vaccine mandates. That was WUSF.org, December 27th, 2022. Thousands of workers are opting to get fired rather than taking the vaccine, the COVID vaccines. NPR, October 24th, 2021. And that story starts, Washington State reports that so far nearly 1,900 state workers, including the head football coach at Washington State University, have quit or been fired because of their refusal to take these COVID shots. These people here are the real heroes in America right now. With all we know about these COVID shots, with all we know now about COVID and how really the fatalities due to COVID were actually limited in scope. That those who died from COVID died with COVID, died in large part because of some other health issue they had along with COVID, diabetes, obesity, which we aren't supposed to talk about because that's politically incorrect. But rare was the patient admitted to the hospital with only COVID who then died from COVID. And COVID having health impacts on children, COVID in children, that was a big yawner. Big yawner, wasn't it? Just really didn't happen. Children dying from COVID. Anthony Fauci, wrong from the beginning. Anthony Fauci, wrong in the middle. Anthony Fauci, wrong at the end. Anthony Fauci, wrong today. And all his minions that pushed the shots as this big saving grace in the coronavirus crazy. Before I get into all that, I want to quickly mention, if you like Bold and Blunt, you may get Bold and Blunt at edify.app, at washingtontimes.com, at Real Life Network, and wherever podcasts are offered. And go to washingtontimes.com, scroll to the bottom of the page, click on the newsletter section, and sign up for my Bold and Blunt with Cheryl Chumley newsletter. You'll get my commentaries that I write at the Washington Times, as well as my twice weekly Bold and Blunt podcasts. I really appreciate you if you are already a subscriber. Thank you very much for that. The vaccine mandates were about the worst thing to come out of all these years of coronavirus, because it put government in the position of dictating an experimental shot must be taken as a condition of maintaining employment, as a condition of maintaining your status in the military. It was a disgusting, shameful moment in U.S. history, and the fact that the U.S. Supreme Court ruled sort of conflicting opinions, allowing the free market to set the conditions for healthcare workers, right, to take these shots, but other businesses could not mandate the shots. It was sort of a stutter step. It was interesting that on one hand, the mandates were not constitutional for one set of employees in America, but on the other hand, quite constitutional for another. And again, we're talking about free market employees as well. But I want to go back in time and play you this Fox News 5 discussion involving Geraldo Rivera. If you recall, Geraldo Rivera was one of the most vicious attackers against those who did not want to take the COVID shots. And he basically came out and said that anybody who didn't want to take the COVID shots should be forced to stay in their homes because they were a danger to his kids. Well, this was a discussion that was had on The Five in 2021, and the voices you hear are Geraldo Rivera, Jesse Waters, and he's referencing also Greg Gutfeld. So listen into this, because this is a good summary of where we were at in the United States, in case you've forgotten.
Geraldo, on the 4th of July, President Biden had this big event at the White House, had declared basically our independence from the pandemic. Perhaps premature?
Oh, perhaps premature, but I think the vaccine is absolutely bulletproof against this damn disease. We had a lightning storm in Cleveland last night. It was as likely to get hit by one of those lightning bolts as to get this terrible disease if you are vaccinated. This is a disease of the unvaccinated. I am appalled, however, by these gentlemen to my left, ironically, who blame the border for the spread of this disease without any evidence. Where is your proof that the
it's called common sense, Geraldo.
Well, common sense is not proof, Jessica.
Geraldo, so you don't think it's a coincidence that all of these variants are popping up in the very places on the border that Biden's opened?
You
don't think that's a coincidence?
To demonize that population.
I'm demonizing Joe Biden. All right?
You have
not the immigrants who haven't been vaccinated. I'm demonizing
Joe. Even an anecdotal story of a bus pulling into a town that later had an outbreak. You have nothing like that. In terms of the mandatory vaccines, Greg, I don't know any Jeffs. Greg, to say that the demonization of the unvaccinated, it's not appropriate. You have to understand that if you're unvaccinated, then you should at least get tested every week on your own, or understand why you are banned from the VA, why you are banned from restaurants, why you are banned from other businesses and colleges increasingly, and they should be, because it's selfish. If you're unvaccinated and you're going around without being tested, you are an arrogant, selfish SOB.
You got proof of that?
Unbelievable. Because look, the gaping hole in the logic here is that all in the span of a minute and a half, right? Because that's about how long that clip was. Geraldo talked about the shots save you from getting COVID, right? Calling out the unvaccinated as the reasons that COVID is continuing to spread at this moment in history. And saying at the same time that if you refuse to get the shot, that you should stay home, that you should be forced to stay home, that you should, well, in this clip, he says that you should be forced to be tested. And if you're banned from public places, that's your own fault because you refuse to get the shot. And in so doing, you're spreading COVID. Well, if you're somebody who has the shot and somebody who believes in the power of the shot to protect you against COVID, what difference does it make if the shot works that well if other people don't get the shot? You're protected, right? And if you're a parent and you're worried about your kids and you get your kids the shots, then they're protected. If you believe in the power of the shot protects you from catching COVID, whether someone else gets the shot or not. It's common sense, which Geraldo, in his own words, doesn't believe in. Where's the proof? Where's the proof that the thousands let in the border who were not forced to get the shot or were not forced to socially distance and who were let loose in parts unknown around America, carrying COVID with them, perhaps not, we don't know. Where's the proof that they spread COVID? It's common sense. Of course it is. But see, common sense under COVID just flew out the window. And it was all fear driven, and it brought out the tyrants like Geraldo Rivera, who could not critically think on their own and who do not believe in God so much as the power of man-made science, and decided that their belief and their faith and their lack of critical thinking and lack of research and so forth should be imposed on an entire nation of people, nay, an entire world of people. That if Anthony Fauci said one face mask is good, so it's common sense, two face masks are better, then this crowd of tyrants who don't believe in common sense nonetheless agreed with the so-called common sense of Anthony Fauci. Anthony Fauci, who, if you go back in time, actually talked about wearing gloves and walking around with gloves as well, which was quickly squashed, I have to say, but the headlines are still out there. So that was America under the coronavirus, led by people like Geraldo Rivera, who had loud mouths and loved to proclaim loudly and widely that those who dared to critically think on their own and those who dared to exercise free choice were dangers to society, ought to have been locked up, and ought to have been forced to take experimental shots, ought to have been forced out of work, out of their jobs, and they brought it on themselves. That was the overriding mentality of these tyrants. That was America then. And America now, sadly, there are still shot mandates in place in some parts of America. There are still people walking around wearing ridiculous face masks as if it stops anything having to do with the coronavirus. There are people who are still sticking their little kids in face masks. There are people poised right now to inject their children with the next booster that the bureaucrats in the CDC, in the FDA, the ones that we lost trust in, the ones that actually we never should have had that much trust in because they're still a government entity, but the ones that we've lost trust in, rightly so, the ones that recommend these shots now in children as young as 6 months old, and there are parents out there now who are considering that advice. Far fewer nowadays than a couple years ago, but still enough to have a concern. The big problem going forward now are questions about the next pandemic that comes along, because Bill Gates published a book amid the coronavirus, How to Beat the Next Pandemic. And in it, he suggests using tax dollars to create rapid reaction medical teams to run around the world anytime talk of a virus pops and do some quick scientific-based research into the situation and then recommend no force mitigation efforts. So if you think that the lockdowns and the losses of individual liberties and so forth was just a one-time thing in your lifetime, just pay attention to what's going on in Bill Gates' world, in Anthony Fauci's world, in the World Health Organization and the World Economic Forum's worlds, right? Because the World Health Organization right now has in place a treaty that would put one person at the World Health Organization in charge of looking around the world to stop pandemics from spreading before pandemics actually pop up, before viruses reach the level of pandemic phase. And how would the World Health Organization accomplish that? Same way they pushed it before. Lockdowns, everybody stay home, wear face masks, get shots, more shots. Big Pharma loves this because, of course, Big Pharma profits from it. But for the rest of us in America, we have to sort of step back and analyze the 3 years under the coronavirus and really assess people like Geraldo Rivera in charge of the situation, in charge of our own individual medical choices? Is that what we want in America? Firing people because they try to claim a religious exemption, or firing people because they say, hey, hold the phone, I'm not secure with this shot, I'm not comfortable with putting this experimental shot in my body at this time. Firing people because they dare to try and control their own medical decisions. Do we want to go down that path again? It could happen. It really could. Because there are people still out there that advocate for Americans to continue to wear face masks, to continue to social distance, to continue to get booster after booster after booster. It's a tragic situation when Americans lose their rights to determine their own medical health choices, and not just lose them, but willingly give them up. So those people out there who lost jobs, lost income, lost careers, lost the esteem of their fellow colleagues in their chosen career, perhaps had rippling effects that led to loss of family security, led to divorce, led to all kinds of divisions in their family and communities of friendships and so forth. To those people, those are the real heroes in America right now. And I want to introduce you to my guest today, who is one such hero. His name is Mike Donio. He is, or was, a molecular biologist, right? Schooled in biochemistry. He spent 20 years or so in this field. Fired because he refused to take the COVID shot. Mike Donio, thank you so much for being on Bold and Blunt. It is really great to have you here.
Thank you so much for having me on, Cheryl. I really appreciate it.
So your background, your area of expertise is as a scientist in biochemistry, molecular biology, and your Twitter feed, your Twitter bio, or X bio as it's called nowadays, it says you have 20 years research as a scientist in a lab until you were fired from your job because you would not take the COVID shot. Take us through that story. What happened?
So I had been in research, doing lab research, drug development for the majority of my 20-year career, largely in pharma and biotech. Most recently, I was at a small biotech startup. I was a senior scientist. We were developing antibodies to treat cancer. I had helped bring 2 antibodies into clinical trials, and that led up to, I guess it was about September of 2021, and the company, like pretty much the entire biopharma industry, rolled out a mandate, said everybody had to get up to date almost immediately, and I submitted a religious exemption. They denied it, and I still would not budge on it, and they terminated me.
Now, what were your reasons, your personal reasons for being reluctant to take this shot?
Yeah, so for me, that it kind of falls into 2 main areas. One being my strong Christian beliefs, and then number 2, being a scientist. I guess, and I was a little bit naive about this. I assumed most scientists would actually want to do a little bit of research into this, being it was a new technology. And, I was kind of surprised how many just accepted it, at face value and just took it. But I, for whatever reason, wanted to dig a little bit deeper and understand what these technologies were, and try to make sense of it to inform my decision as much as possible. And the more I dug and found out about it, the more I realized it was similar to technologies I've used throughout my career to to engineer cell lines to study the functions of different proteins to test drugs on and things like that. And I said, why would you want to put this into humans, number one, and number two, especially at this level, this scale, with the limited amount of testing that's been done. So there were just so many red flags that the two of those things combined, I just said, I can't do it.
There were tons and tons of red flags that we who wanted to maintain a critical thinking approach to determining our own medical choices, right? We're told, oh, nothing to see here, go home, take the shots, no worries. But I could not get past the fact that the science community kept pressing the idea that if you said these were experimental shots, if they had not been tested for the long term, you were shot down as being a conspiracy theorist. And that's just common sense. The shots just came out.
Yeah, I was absolutely shocked at just how the scientific community almost blindly accepted it. And even when I didn't and was terminated, how almost, how so easily they just said, well, all right, it doesn't matter how long you worked. It doesn't matter how connections that I had for decades in the industry and stuff like that. People just said, nope, I can't help you. I can't, I don't understand your decision. I mean, to just go blindly along with this and be okay with overturning people's lives for something that was so untested is just mind-boggling.
Especially if you just paid attention for the first few months, right, of the shots development. It came out that these big pharma companies said that their efficacy was 95%, 97%, 90%, and so forth. And then you just wait a few months, and that those efficacy rates were then all of a sudden being put at 60%, 50%, 40%. And that's why we need booster after booster. How could anybody not have alarm bells going off in their heads after watching those news headlines?
Right. I mean, as you're seeing the messaging and the data changing in real time, any sane person should see that and go, okay, wow, this is, I should be kind of changing my thinking about this as time goes along instead of just hardening it almost the other way and saying, nope, we don't care. We're going to stick to this, despite the fact that, all of the evidence continued to pile up, demonstrating that these things were not what they were initially put forth to be. And I think there was a lot of evidence, even if you looked back before the vaccines, at the earlier attempts to push this technology, this mRNA therapeutic technology, to get regulatory approval on that. Initially it was tested for cancer, for some rare diseases. There were significant issues. It couldn't get through clinical trials going through the normal regulatory pathway, which I think kind of led into it, utilizing the vaccine pathway, regulatory pathway, because that's a lot easier. And then when you add on to that the whole emergency situation, it took something that was, may have been almost dead in the water and gave it entirely new life, a pathway that it would have never had previously.
Okay, see, you bring up a very good point, and I just want to explore that a little bit further, because in my own research, I found that the messenger RNA technology had been tested for years and years and years, and it never did have a successful outcome for what it was ultimately used for, the COVID vaccines, or COVID shots, really is what I call them. And so the technology has been in place for years. And as you just pointed out, it hasn't been successful until we were placed under emergency use authorization and then forced by our own government and private sector to take the shots.
Yeah, absolutely. I mean, people should realize that this was not a new technology. What was new about it was changing it from a therapeutic, it was essentially a next-generation gene therapy that became a vaccine when the initial kind of drive wouldn't bear fruit in terms of gaining regulatory approval. And so, then COVID presents itself as this opportunity combined with the emergencies that gave them a path to approval that didn't seem to exist previously. And you also had you noticed that even the definition of vaccine was kind of changed to fall in line with that.
And okay, so the lies piled on top of the lies on top of the lies, and those were the then lies. But now let's look at the nowadays lies, because now we have, it seems to me, an utter dismissal, a whitewashing of any type of negative health impacts that these mandated shots in many respects have given. Can you speak to that? Can you speak to the actual truth of the safety of these shots?
Well, yeah, I think the first thing is that there was little to no. They actually managed to somehow bypass the normal safety testing and just rammed it right into human clinical trials. That was one thing. And then, the whole trials were mishandled, so you didn't get a accurate picture of what was going on in terms of the adverse effects. And that's just been, one thing after another where it's been kind of covered up, or, don't look over here, this is caused by something else, or, but yet we see such a preponderance of evidence that keeps piling up, showing that people that have gotten these things are having a whole wide range of issues, whether it's vascular things, or even potentially cancers. That you just can't ignore the numbers, the sheer numbers that are popping up. It's astounding, and the fact that you didn't have proper clinical trials, proper safety testing, speaks a lot about that there was so many unknowns, yet they just pushed it right through.
So the myocarditis, the heart issues in especially young males, that is a figure that do we have an actual figure on the direct correlation between that and these shots, or is that still being disputed? What are you finding?
Yeah, I don't know what the actual numbers are, and that's one of the problems. Though it's hard to get true numbers because nobody wants to admit that it could be caused by the shots. So it's hard to get. That's been the problem throughout all of this. Whether you're looking at VAERS numbers or anything else, it's just always been a challenge to get a realistic understanding of the picture. But it certainly seems like there is a strong correlation, and I know that there's been a lot of good minds trying to put their heads together to figure out what could be the kind of underlying, I guess mechanistically what's going on there, what's driving that, why young males. I've seen some interesting theories, but I don't know that anything has been formally studied to actually gain more understanding there.
Based on your science background, based on your knowledge of the field, and based on your inquisitive mind that has led you to do some research about this whole COVID crisis and so forth, what would you recommend parents of small children, parents of college-age children, and adults in general in America in regards to future booster shots?
Yeah. So, I'm not a doctor. I'm not giving medical advice. But the best thing that I think anybody could do is, we're at a time where we are being flat out denied, informed choice. We're not being given all of the information. So, I think it's imperative that people, parents, I'm a parent myself, that we take it upon ourselves to get as much information as we possibly can. And I understand that I take for granted how for me, digging through complicated technical scientific information is, kind of second nature. But for a lot of people, it can be, overwhelming and challenging. But I think it's something that, we need to get that information one way or another so we can make informed choices for ourselves, for our children. We can't rely on the traditional sources anymore because we just don't know what to believe. And you have to have your children's best interest and protect them as much as you possibly can.
That's the problem now, right? We just don't know what to believe. Our so-called trusted medical bureaucracies in the federal government let us down. And just to wrap up with this, first off, give an update on where you are. Did your company apologize to you? I doubt it, but where you are. And also, regarding going forward, mandates have to be always fought. Any type of mandates, I would say, is where we should really fight as an American public. Do you agree or disagree?
Yes. So to answer your first question, the company has not apologized or anything. I am still in the process of trying to mount a legal challenge. In fact, my attorney finally was able to file a suit like 2 weeks ago, a week or two ago. And so I don't know what's going to happen with that, but I think, as you said, to your second point, we have to fight these things because this was such a gross overreach of power and just even morality, like how we treat our fellow men and women. That this is not how, in any society, civilized or otherwise, that you should be treating other people and forcing these things upon them. And when this sort of kind of situation happens, I think it's imperative that we challenge it. And it's one of the reasons why I said, nobody asked for any of this, but I think what we do and how we respond to that is really what defines us. And I respect people that just, that didn't want to speak out or didn't want to, or don't have the ability to fight back in certain ways. But I said, I have to do something. And so I'm still trying to do the best I can, but, I don't know. I mean, the system is in such a weird place right now, especially the judicial system, that you just don't know if you're going to get a favorable outcome. You would think you should, but we're in a weird place right now.
Yeah, it's like, evil's been flipped for good and good for evil, and common sense has flown the coop. And I see you do have, though, on X, social media X, @ScienceDefined. You are the founder of that. And is that sort of your way of making it, giving science a more layperson approach?
Yes, exactly. So, after I was terminated, I ran into a lot of trouble trying to get back into the industry. There was a lot of barriers. There's still a lot of places that are requiring the shots for employment. So I realized I have to carve out a new path, and I said, we need solutions. We need something that can help people to break this information down. I saw in my friends, my community, family, people that were struggling with all of the information being thrown at them, how highly technical it was. On top of that, you have people saying, if you're not a doctor or a scientist, whatever, you don't get to ask questions or discuss this stuff. And I said, well, wait a second. This is stuff that impacts everybody, that has a direct impact on your life and your livelihood. That means everybody gets to ask questions. Everybody should be able to enter into this discussion. So this Science Defined is about making that feasible. But it's an educational platform that will hopefully equip people to understand and navigate the complex terminology and concepts that are used by doctors and scientists in the medical industry, such that you can be your own health advocate. If the pharma companies aren't going to give you informed choice, well then we're going to help you to have the confidence to identify the information and resources that you can rely on to make those decisions for yourself and in your family, so that you can digest those crazy complex scientific studies and be able to pull out the personal impacts and put that into action in your own life. Which is how it's supposed to be in America. Mike, I want to thank you for coming on Bold and Blunt and sharing your story, and also the fight, the personal fight, and now the at Science Defined fight that you are making on behalf of Americans. Your handle is at Mike, Donio, Mikedonio, and at Science Defined is what you have founded. Thank you so much, Mike, for taking the time on Bold and Blunt. Thank you. I really appreciate it. Get the shot, get the shot, get the shot. The media, Anthony Fauci, they're all out there still telling to get the next booster shot. And to give the shot to your children as young as 6 months old. Think carefully before you take this jump. I want to thank you for listening. Remind you, if you like Bold and Blunt, you may get Bold and Blunt at edify.app, at Real Life Network, at WashingtonTimes.com, and of course, wherever podcasts are available. Tune in next time. In the meanwhile, stay blunt, stay bold.